Um, yeah, welcome everyone to Demo Day 6. Really appreciate you all taking the time. My name is Xia Huang. I am the COO and co-founder here at Nava. I wanted to start off by reintroducing Nava a bit and resharing some of the context about why we're here. I know there's some folks who know us and some folks who don't know us as well. Um, Nava, we're a public benefit corporation, and as a public benefit corporation, we've spent over a decade now supporting some of the hardest challenges in the public sector. We've entered no-fail, high-risk, high-complexity efforts to take on deep legacy modernization work, taken on crisis response work, or shifting entire agencies from an enterprise-wide IT and operations kind of standpoint. Our public benefit corporation governance structure means that we measure ourselves by our mission and our impact. And I'm really proud that we've been able to support enrollment of around 100 million folks enrolling in critical benefits programs, saving thousands of years of manual labor amongst caseworkers and civil servant staff, supporting the disbursement of billions of dollars to parents, households, healthcare beneficiaries, veterans, and more, and ultimately supporting the reallocation of billions of dollars in unnecessary costs. Last year, in the run-up to HR 1 and following its passage, we've been talking with states across the nation, some of you on this call, unpacking the timelines, impacts, and changes necessary both on the Medicaid and on the SNAP side. I'm deeply grateful for the work and conversations many folks on this call are driving. I'm deeply frustrated by the lack of options to drive effective implementation. But we do believe here at Nava that this is an opportunity to break a cycle of big legislative efforts that cause huge churn for state leaders and challenges in delivery for residents and state workers. So, in an effort to fulfill our public benefit mission, we've been working rapidly, aiming for delivering wins in weeks rather than months. And we're committed to working in the open and sharing our progress with you as we go. We know HR 1 covers a lot of changes, and we know through these conversations, folks are hungry for viable options. So, as Tiffany mentioned, we'll share more of our work today. We've been working across many work streams from from the open source kind of perspective. We'll share updates on both the SNAP error rate and Medicaid community engagement side today. Um, as I've said before, I don't pretend that what we'll show today is perfect or finished. We deeply believe that publishing work in the open this way allows for more accountability and allows you, as states, to own your own futures compared to SaaS or other proprietary solutions. So thank you to the many states who've given feedback and engaged with us, the teams that have spun up your own instances of Oscar, as we've previously announced, we're very excited to support efforts in Maryland, Pennsylvania, and we'll be able to share more publicly soon. I'm deeply proud of the hard-won work and progress we've seen already in lowering states' payment error rates, real, meaningful preliminary results that, if they hold, can save up to hundreds of millions in cost-sharing avoidance. So our goal is, as it always has been as a public benefit corporation, to deliver and to deliver quickly on behalf of agencies that are often strapped for capacity or caught in expensive cycles of contract mods. So now I'll turn it over to Sumi to lead the demo. Thank you all very much for taking the time today.